It's just fatigue, it's shortness of breath, and I'm not really sure getting into this therapy, this chemo and radiation, how that's going to make me feel, or if I'm going to have to look at this in a different way.
Okay. Those are just the sorts of things that I hope I can help you with, and those are very common symptoms for people with lung cancer to be experiencing. So fatigue is one of the most common symptoms that cancer patients have, and it's due to a lot of different things. It can be due to other medical problems that you have. It can be due to your cancer and the tumor growth. It can be due to medicines that we give you to manage symptoms, and chemotherapy and radiation treatment. So it's due to a lot of different things, and it can be challenging, but I think we can help you with that through a number of different methods. First of all, are you getting good sleep at night?
I don't know if it's good, but I'm pretty tired, so I am sleeping. It's not like I'm waking up or anything at night, but
Good.
I feel like I'm sleeping, but I'm still just a lot more fatigued than I used to be.
And I'll also, look through your laboratories. Sometimes anemia, which can come along with cancer and treatment, can be a cause for being both fatigued and short of breath. And we'll make sure that if you are anemic, that we give you blood for that. Also, sometimes we have medicines that we can use to address both mood and fatigue that can be stimulating and can give you some energy. And we'll also talk a lot about pacing your activities so that, if you are still working and continue to work during treatment, we can talk about how to take on the activities that are most important to you and most satisfying, and also things that need to get done in the course of the day, but how to rest so that you can get through your daily activities and not just be exhausted and still also have energy for treatment. To adjust at work as well, and the social worker especially can be very helpful in how you talk to colleagues at work and how you manage your work schedule with treatment and with your illness.
What I was hoping to talk about is I have, which you've probably seen in the chart, diabetes. And probably through my own fault, I haven't really been keeping up probably as well with that as I need to be. And I don't know how that's going to mix in with the different maybe medicines that I'm going to start taking now.
Right. Well, it is going to be important to manage your diabetes fairly closely. With chemotherapy, if that's part of your treatment plan, that can lower your cell counts and put you at risk for infection, and just having diabetes increases that risk too. So we'll need to make sure that your blood sugars are controlled, and also some of the medicines you might get with chemotherapy, like steroids, they also put you at risk for infection, and they can elevate your blood sugars. So if you get steroids as part of your treatment or symptom control, then we will just adjust your insulin. But it will require your checking your blood sugars on a regular basis. And I don't know how often you check them now, but that might be 3 to 4 times a day, so that we can help you to adjust your insulin to minimize the risk of infection or other complications, and so that you can take dexamethasone with treatment.
I'm going to probably have to take on that responsibility, because 3 or 4 times a day is what I'm supposed to do, but I get so rushed at work that maybe one time, maybe twice a day.
Right. Well, why don't we sit down and look at your blood sugar log? And I'm happy to work with you on that if you want to bring that to clinic. We can set up a log if you don't already use one.
Right.
And that can be something that you take to work with you. And if you don't have a glucometer that works, we can help you with that and assist you with diabetic education, so that we can make it as feasible as possible for you to maintain good sugar control. I know that's challenging, but let's start now with that. I can tell you're short of breath, too, and I know you mentioned that that's been a problem with fatigue, And so has that been going on for some time, and do you have any underlying lung disease?
That's where they said the cancer started. My shortness of breath has probably been going on for about 6 months now. The fatigue is really just or started, I've experienced it more probably in the last 2 months. So it's just starting to build. I was a smoker for years and years and years. After all these complications, I have quit, but I still have this edginess to me, this, almost wish I was smoking because it actually helped. It seemed to help in situations.
Right.
My wife wants to really help as much as she can. I hate to put any more burden on her than necessity, but I believe my wife, and I have a daughter who's in nursing school right now, that I think they would like to try to be more involved, and I think at this time I might have to call upon them to push me or help me a little bit.
Well, I can rest assure you that when I work with families, the one thing that other family members want to do is to be of help as much as they possibly can. So I'm sure you're not a burden to anybody. And when you make that marriage vow for better, for worse, this is one of those trials. So feel free to ask for assistance, because I'm sure she would do the same for you.
I guess if I don't know if we can have a meeting or something, because it's not only the smoking they can probably help with, but some of these new treatments and some of the side effects. I'd like for them to be kind of informed too of kind of what's coming up, what I'm going to be faced with.
That's really important, and just the opportunity for them to be able to participate and sit down with the family meeting. In the family meeting, it would involve your family or as many of your loved ones that you would like to come, and those people who will be assisting you. And they can sit down with you and give them updates about what's going on with you in a particular time in your condition, as well as be able to assist you in things like conserving your energy if you're having fatigue. And this is a good time to be able to delegate. And I'm sure your family wants to do as much for you as they possibly can. But then at the same time, I'm sure you want to continue to be able to do what you can when you feel like doing those things. So it'd be important for everybody to be on the same sheet of music. And so having a family meeting would definitely be something that would benefit not only you, but all the people who are on your team, that we can all get together and talk with you at one time.
I'm sure that they love to participate.
Sitting down with the family, with all of your treatment team members, will be instrumental in helping you put a plan together. And I know that in the near future we will be planning a meeting with you. So I'm sure there are a lot of things that are going through your mind right now, and questions.
Yes.
And there are probably questions that your daughter and your wife might have. This would be a great opportunity for you all maybe to sit down at some point and maybe write all of those out, so that when we come to the table again with you, that we'll have be able to give you a better script, so to speak, for your care goals in the future.
This sounds like a great idea, because I remember times in the past walking out of doctor's office saying, why didn't I ask that? Why didn't I ask that at that time? So I think coming up with a sheet, myself, my wife, and my daughter, of questions that they might have would be a great idea. And actually, this meeting today has taken a little pressure off my shoulders of things I was kind of worried about in the future, how all this was going to fall into place.
Well, thank you so much for allowing us to be a part of your team. But remember, you're still the quarterback.
Okay.
Thanks so much. Thank
All
you.
right. Thank you.
I'll see you next week.
Great.
All
Look
right,
forward
thank you.
to it.
All right.
All right. Primarily to go to
Okay.
in case there are questions that need to be asked.
That's your support system.
Yes.
That's where your go-to
Yes.
with something women, young women.
Yes.
Your daughters are in their 20s. What are their names?
I have Amanda
Uh-huh.
and Jennifer.
Amanda and Jennifer. And where are they?
Where are they?
Uh-huh.
Oh, they're in Louisville here.
Okay.
They're both in school. One's going to regular college, and
Uh-huh.
actually one's a nursing student.
Oh, so she's going to have some knowledge and
I'm already getting a little input that
You're
I'm
already
not
getting-
sure if it's right or not.
if your family is anything like my family, you're going to be getting probably quite a lot of input.
All right.
So Amanda and Jennifer, and then what was your wife's name?
It's Judy.
It's Judy. And she is your second wife. Is she the
Right.
girl's mom or?
No,
Okay.
she's a stepmom.
She's a stepmom.
Very good stepmom.
Okay.
though.
And Amanda and Jennifer's mom, is she in the Louisville area?
She passed on about 15 years ago.
Okay.
We had
Okay.
we had a divorce situation, and I guess it was more pressure on her than it was on me. But she overdosed. She took her own life about
Oh my goodness.
2 or 3 months after the divorce, and it's just a hard situation. Even
Okay.
15 years ago, it's still a hard situation.
And how, I can't imagine, but how was that for your girls and for you? How did your family?
I hate to even go there,
Uh-huh.
and then I almost feel the girls are throwing some guilt on me,
Okay.
I think. I thought after 15 years it's starting to wear off, but
Okay.
there's still some there.
There's still some there.
Yes.
And so their mother is gone, and now their father is very seriously ill. And so they're part of your support system. Are they part of? You'd like to have them be involved in making decisions, or?
That's one thing I want to try to
Want to try
figure
to figure out. Okay.
Yeah.
Okay. Well, the good news is we're having this discussion relatively early, and you still, although you're exhausted, and we keep sending dozens of people in to pump you for more information,
Right.
but we're having this discussion relatively early, and we absolutely can talk with all the members of the team. We can even, if you would like, have some discussions and involve maybe Judy or one or both of the girls, and allow you to make some choices about your care
Yes.
and how you want things to go.
And then have them involved on the decision process.
Excellent. We can absolutely do that. And I will have some more information on that I'll give you today, and then we'll get started in the process of getting some of those things on paper, so you can then talk to the girls and to Judy. Are you still working? I know I had heard that are you a banquet chef?
Well, I'm actually a restaurant manager and
Okay.
a catering manager for
Okay.
a big hotel in town.
Okay.
And I'm still working to an extent, but I'm not sure how much longer that's going to last. I might have to take some medical leave, which
Okay.
I don't really want to. I'm a little afraid of the insurance situation that's going to pop up, that I'm going to lose my insurance if I go on an extended leave. So there's just a lot of questions going on right now in my mind.
Absolutely. And it makes sense to me. It sounds like a lot of people depend on you, and you're a really important person to a lot of different folks. I can absolutely help you get some information and make some decisions and have a plan in place for some of those financial pieces as well. I guess I always want to be honest and make sure people don't have unrealistic expectations.
Right. What type of chaplain are you?
Well, I'm a Presbyterian minister, but as a chaplain here at the hospital, I minister to people of all different faiths.
Okay. I've been with the Christian Fellowship now for about 15 years,
Okay.
and it's been a very rewarding experience.
Good, good.
Uh,
How has your illness impacted that part of your life?
Well, the problem is that being very sick, that that's probably when I need my church the most, and I just haven't had the opportunity to get out and be with my congregation
Yeah.
as much as I would like.
Yeah, yeah, that makes sense. When you need them the most, that's when you can't go.
I
Yeah.
know,
Yeah.
I know.
Yeah. How's your pastor been of support to you?
My pastor has been a lot of support. He tells me to believe in God, and through faith in God, that God can help to heal me of the cancer. And I want to believe that, but sometimes I wonder because of the way I do feel.
Yeah, yeah. Tell me more about that wondering.
Well, it's not all about the cancer. I kind of wonder that right before I joined the church, I had a divorce with my wife. It was a mutual divorce, but within the year after that, my wife had an overdose, and her life was taken from her. Ever since that, I've felt a little guilty. Even I feel a little guilt from my children that I had something to do with it, and I don't know if this is. I believe God is a good God, but I'm kind of wondering if He really maybe hasn't forgiven me, or if there's something going on.
Yeah, yeah. Tell me more about that forgiveness. If I'm hearing you right, you think that maybe your illness is related to.
Yeah, I don't.
What happened to your
I
wife?
don't want to believe that, but that thought kind of creeps up in the back of my mind, and I guess that's when I need probably to be with my church community more to help me through those thoughts.
Yeah. What does your wife say about all of this?
Well, my wife's very supportive. She believes in the healing of God. She believes that if it comes to the point that I might be close to life and that maybe using some type of support system, if it's a ventilation system, if it's something to help me keep going, that will give God more time to heal me of the cancer.
Oh, okay, okay. Well, that would be an important thing to talk to the rest of the team about. I think those decisions are important to make in advance, to talk about what might happen and what your wishes are regarding that. So I think that would be a good point to maybe have your wife come meet with us as well and meet with the rest of the team so they can tell you about the medical side of things as well and what they recommend.
And if we do that, and I would hope that we do that, I'd like to get my children involved also.
Okay.
They're wonderful children, but it's, like I said, in the back of my mind sometimes I don't know if they've given me complete forgiveness or not for the situation with their mom.
Okay, okay. So you feel like they might even blame you for what happened to her? Or?
Yeah, I don't think they intentionally do, but
Sure.
I
But
do
you
get
feel
that.
that.
I do get that feeling.
Is there anything specific that you're praying for right now, besides
Really
the things we talked about, just your
just
health?
helping through this pain with the cancer, and helping and asking God to help me through this.
Yeah, yeah, okay.